So, for the past few episodes, we've been talking about the importance of better gut health and nutrition. And I promised to bring in a liver expert to talk about fatty liver disease, which has now become an epidemic in the global population. So, I called my dear friend and colleague, Kristin Kirkpatrick from the Cleveland Clinic, who is widely considered to be one of the top dietitians in the United States. And Kristen's got such a great way of explaining this in simple terms. Her two books, Skinny Liver and Regenerative Health, really helped me to understand fatty liver disease better. But I want to start the conversation by diving into her personal story because it's such a great example of listening to your "it has to be me" moments to get really clear about your calling and what you want your contribution to be. And then we'll dive into getting all of the juice from her about fatty liver disease. Now, we had a little bit of a tech issue during the interview and there's a bit of a delay. And so if you just hear that slight delay, that's what's going on. But I just wanted to keep the conversation exactly how it was because it's just so incredible. You know, when you meet somebody and you go, can this person really be this incredible? And then the more you get to know them, the more you realize, yeah, you know what? They're even more incredible than I thought they were. So let's get the skinny from Kristin Kirkpatrick. I am here with Kristin Kirkpatrick today. Oh, I'm so excited about this interview. I couldn't sleep because her story is so incredible and so many twists and turns to this incredible journey of being an award-winning dietitian, one of the best dietitians in the United States, I'm going to say the world, at Cleveland.
Wow.
Oh, and author of Skinny Liver and the follow-up book, Regenerative Health, which, oh man, I love these books so much. We're going to dive in today. Kristen, you would have seen her. She's, a contributing writer for today.com and, the New York Times interviews her. She's been on the Dr. Oz show, the Today Show. I mean, you name it. Tons of magazines, newspapers, it just goes on, and really influential in talking to people about health in America. So, Kristen, thank you for joining me.
Oh my gosh, Tess, thank you. Thank you. And I always think like, man, you impact so many lives. So it's just such an honor and a privilege for me to have just even a small piece of your world to your audience. So thank you.
Oh, gosh, you're being humble and kind. Kristen has spoken several times in my SK60 community for my 60-day reset, and the love looms large for Kristen. So, you're such an authority and so incredibly knowledgeable, as a dietitian. I'm just really interested in sharing a little bit about how your journey with food started because your journey is such an interesting one. So I want to take everybody back to your childhood and your relationship with food as a child.
Yeah, it's so interesting. And I think you think about that when you have your own kids, right? Because you look at their eating habits and you stop yourself when you're like, you can't leave the table until you eat all that salad, right? And I think about that from my childhood. But I was an obese child in adolescence. I was, it's interesting. There's this symptom that you have that indicates that you're insulin resistant or even type 2 diabetic. And it almost looks like there's like velvet underneath your armpits. And it's this actual symptom that occurs. So I go to my primary care physician, my pediatrician, my yearly visit, and my arms are up. And he said, "What's that?" And he looks at that and he's like, oh boy. Okay. So then from there it was, let's test her blood sugar and all of these things. And we find out that it's like, it probably was very severely insulin resistance, not quite type 2 diabetic, but major blood sugar problems. And that was kind of like the big aha moment for my mother to say, gosh, we have to lose weight now. You have to go see a dietitian, etc. So that was really the beginning of my journey. And I remember walking into this dietitian's office and she was like, in my mind, like a size 2. I was not, right? So I kind of shut down a little bit because I'm just like, oh, God, she's perfect. And she had asked me, she said, well, what do you think we're doing wrong? And I thought it was really interesting, even at that young age, that we're going to start with the, what are you doing wrong? Implying that there's something wrong with what you're doing, and we can sum it up into one sentence, right? Which we can't. We can't sum it up into one sentence. So I let her in on this dirty little secret that I used to go babysitting, and I would take my money, get on my bike, because then we could go bike anywhere and not worry about, safety. get on my bike, go to the grocery store, come back, and I had these little Debbie bars, and I would put them underneath my bed. And when I knew my parents were asleep, no one's watching, I'd take them out and I'd start eating them. Right. So clearly looking back, clear anxiety, and I'm trying to cope with the comfort of food, the comfort of that without being judged, because it's the middle of the night. So I let her in on this little secret I have. And she said, okay, well, gosh, yeah, that's a tough one. Let's just stop that today. And then we're going to start to improve your eating habits. And I thought to myself, I've wanted to stop that for years. So yeah. I think, this is not mind blowing for you to say, let's stop that bad habit. Right? It's just like, stop. Just have less sugar, just drink less. Why can't you do that? Right. So I think that was really the eye opener for me. I felt like even though this person had such great intentions, I was not understood. And the complexity behind why I was choosing certain foods was not understood. And until that's understood, you can't really change behavior because you can't get to the root. And it was the first kind of introduction to, I really want to do something where I can understand people. And I can understand when someone says, I'm really struggling with this, or I can't stop eating this. I want to be able to say I've been there and I understood it. And not to say if you haven't been there that you are any less effective than I am when you're in that patient setting, but I had the compassion that I felt like only someone who's been there could have.
So that was a real aha moment for you that then propelled you forward, through your teenage years and then when you went to college. So tell us about that journey where you really started to kind of form your ideas about food, how you wanted to move through the world, and then how that led to, your college experience.
Right. It's interesting. So it took me a long time to try and lose the weight. And I think when people kind of hear my story, they say, oh, how long did it take you to lose the weight? And I always say, oh gosh, probably like 10, 15 years. And then I always follow it up with, I'll let you know when I figure out how to keep it off, because losing it was actually the easy part. It was the day to day of trying to change your relationship with food that becomes really complex. I mean, from a weight loss perspective, it's not as simple as calories in, calories out, but there is a lot of simplicity behind it. If you eat less, if you move, especially when you're young, right? You're going to have probably some success in weight loss. So, I think like when I went to college, once I was successful in losing weight, I almost wanted to abandon that part of it, almost deny that was part of who I was. I wanted to just probably act like I was always thin and always this way and never struggled. So I kind of like pushed it into the back of my mind. And it was like, this is kind of my personality test where I'm, I walked past something. I walked past a billboard in college. I saw that there was an ad for a White House intern. And I was like, wow, that looks cool. Because I went to college in DC. And I applied for it and never thought I would get it. I interviewed and I got it. So I had this great opportunity of being able to work at the White House. I ended up working on the presidential campaign. I mean, it was like the most amazing moments. I'll never forget it. And I don't regret it for 1 second. But the point of this is that like I took so many turns before I went back to that 16-year-old girl that said, I want to understand people. I want to help people. There's no greater turn than getting into politics. I've been saying. Right?
What did you learn? What was your it has to be me moment or it does not have to be me moment about being in the political world at the highest level like that?
Yeah, I think I really embraced the coolness of it, and I embraced that I did feel that I was part of history.
Yes,
and that I was,
you were.
Right. And I felt like I was meant to be there at that moment. But I don't think I ever felt like it was my calling. But it was a great moment at the time. I always just kept getting pushed back to the wellness perspective and trying to figure out what that looks like for me and how do I take wellness and turn it into a career that not only is successful, but also lucrative.
Yes.
Because 20 years ago, I mean, you thought about wellness and it's like, you prep people were like, oh, do you volunteer at a gym or what do you do? Right. It's like, it's not something you would think of in terms of what your career looks like. We've evolved considerably since then. So I think that was like it had to be me moments where I just didn't feel like I was contributing to the world in the way I wanted to contribute. And I
Yes.
just felt as if this isn't the right step. Okay, now I'm 23, but that's okay. Let's kind of go to a deep dive and figure out what is the right step. And it wasn't 10 years lost. It was a great experience, but not right for me. I tell my kids this all the time. You can go through so many different versions of yourself. Eventually you're going to land on who you're meant to be. And sometimes you got to go through all those versions to figure it out, right?
I
Sometimes,
love that. Let me go through some more versions of Kristen. So you then merged your interest in politics, your experience in politics, your interest in the health and wellness space, and then you were lobbying, right? You were working as a representative in DC. Tell me a little bit about that and what you learned from that and how that was the next evolution in you discovering who you were meant to be.
It was it was kind of the perfect combination, right? So I applied for a position at the American Academy of Dietetics, which is our trade organization for dietitians. And it was because I was in DC, it was their lobbying arm. At the time, they were lobbying for something that was groundbreaking in dietetics called MNT, or medical nutrition therapy. So it was the essential lobbying that was necessary in order to get reimbursement to see a dietitian in any kind of hospital setting. So before MNT, it was out of pocket, or maybe your individual insurance company might pay for a session, but this was a universal. So if you had certain diagnosis, things like that, you would have your insurance cover it. So it was so interesting to just be able to kind of be in that world then and work with lobbyists who I had never worked with before, and just look at like what they were trying to achieve from the political standpoint. But really, ultimately, it came down to what we were doing was trying to get people of all walks of life to have access to see a dietitian. Right. And that's really what it boiled down to. If insurance covers it, then anyone can see a dietitian. And we still need to improve MNT. We need to open up more diagnosis for it, but we didn't have it at the time. And so it was great to be part of that experience as well.
Yeah. And so, but through that experience, again, you discovered this isn't quite what I want to be doing. I want to be really in the doing of the helping people get healthy and that kind of stuff. So was that the next it has to be me moment for you where you went, I want to be a dietitian?
Yes. So I was in grad school when I was doing that, and I was doing just a general wellness degree. So again, I did my undergrad, that was political science. Then I went into, okay, I'm going to do grad school, but I'm just going to do general wellness. And I sat with the head of the school, who was a dietitian, and I still talk with her today, still get mentoring from her today. And I said, well, what should I do next? And she said something that I'll just never forget. She said, well, you have this graduate degree, but you are nothing. Like you don't have a title. You just have a degree. So I would be something. So I would be either an exercise physiologist or a dietitian. And that was the moment where I just went back to all those years, all of those things that I tried to achieve, and said, okay, this is what I'm meant to do. It took me much longer than the average person to figure that out, but that's okay. Here I am. And then I had to go backwards to go to dietetic school, because dietetic school back then was an undergraduate degree. So I have my undergraduate degree, then I got a graduate degree, and now I'm going to go backwards and go back to college to be able to get all of the training and internship that I needed to be a dietitian.
Yeah. You returned, right?
I returned. I went back to where I started.
You returned. Sometimes returning is so powerful because we are returning with a different lens, different life experience, more life experience. We have a different perspective, and then we hold that experience differently. So, Tell me a little bit about how you came into contact with the Cleveland Clinic while you're in dietetic school, because that's another "it has to be me" moment, right? Where you met another incredible mentor. I mean, your story to me is such a glorious example of every little piece dovetailing and leading you to the next moment. And I mean, all lives are like this, right? But yours is just, to me, it's just so incredible. Can you tell us about how you were a mature student that had its benefits? You had to work, right? So you were working, and that's when you took the job at the Cleveland Clinic?
Yeah. So I ended up, when I wanted to go to dietetic school, I ended up moving home from DC. So here I am going to leave DC. I'm going to go back to Cleveland to go to dietetic school, where I went to University of Akron. And it was interesting. I was thinking about what you were saying, like kind of, going full circle and coming back. I feel like had I gone to dietetic school right after high school, I would have had a totally different experience. So I go into dietetic school. I am now 29 years old. I have a fiance, completely different place in my life than most of the girls that I'm in dietetic school with. And it was all girls. There was not one guy in my class. And the first thing they tell us is like, well, you can't work. It's so grueling to do the internship and the classes for dietetics. You can't work. And I'm like, well, I just got a mortgage. So I went ahead and I was able to get a position at Cleveland Clinic in cardiovascular genetics. And I worked there nights, weekends, after school, just whenever I could. So again, I had this great opportunity to be at Cleveland Clinic, which is, one of the top medical institutions in the globe, and be in cardiovascular genetics. So I had this genetics education being provided that no one else in my class was being provided, because I was in it, I was living it. And that's really what brought me to the clinic. And as we were there within the clinic, I got a new CEO there, Toby Cosgrove, who was groundbreaking in his attention to wellness. No other CEO of a major medical institution really gave the care and just the attention that Dr. Cosgrove did. So he came in and said, I'm going to create this institute type of format within the clinic, and we're going to have an institute just devoted to wellness. So at that point, I was applying to get kind of into the wellness area of Cleveland Clinic. I started with employee wellness, which I loved. And then from there, I met Dr. Roizen. He ended up being the chairman of the Wellness Institute. And he said, hey, we're going to start this new institute. You want to come be the dietitian? So part of it was luck. I was in the right place at the right time. Maybe a little bit of persistence. I was constantly talking to him, trying to discuss things with him, making connections with him. But
you're fabulous.
What?
You're fabulous. Yeah. I'm sure you wowed him and I mean, you've been there for almost 20 years now, right?
Yeah.
So incredible.
Long career.
One of the things that another thing I really love about your story is this constant story of mentorship. Yep. How you're still in contact with one of your very first mentors, all these mentors along the way, and now you yourself are an incredible mentor for young dietitians. Tell me a little bit about how that factors into your view of the world. Really helping to support and elevate and celebrate others in their journey and really helping them to see what their potential is.
Yeah, I think it's so important because, number one, again, a lot of times we'll take on different things in our life because we didn't have it. And so we take that on as a goal to give back what was not given to us. And so I felt like when I was in dietetic school, all of the people that I was under in terms of like the internships, it was just kind of like, and I get it now as a dietitian, I get it. They were so busy and they were on the clinical floor. They just didn't have time for you. So there wasn't a lot outside of your interaction with these dietitians during the internship. But then if you had one that kind of took you aside and was courageous enough to take the time to say, here's why you did this wrong. Not the one that said, hey, this is great. You get $1 million. This is great. Oh, okay, this is great. We'll see you tomorrow. But the one that took the time to say, here's why what you put in the chart really is not going to work, those are the ones you learn from. So it really kind of spoke to me. I really wanted to work with other dietetic students. I've had men, I've had women, of all walks of life, who can take what their passion is, because they all start with that. They all start with, here's my passion, here's what I want to do. Try and make them figure out how is it going to work for them while still kind of doing things that are outside of the norm, right? Doing things that are outside of the norm. So I think I really love that perspective of it. I love just trying to like open the eyes to some of these interns. I have an intern right now she's great. She's an older intern. She's married. She has kids. So she's a different perspective than some of my other interns. And she's telling me what she wants to do. And she's helping me put together this presentation. There's all these places that like look good, but not great. And that's what I said, like, here's how you make it great, because believe me, it's not just me being hard on you. You are going to get into the world. And if you want to present, your slides have to look engaging and really good. And you got to be ready for that. So I just think there's benefit in being honest and giving people some perspective that you have from so many years of experience that they couldn't possibly have because they haven't been in the industry long enough.
Yeah, and also your life experience, right? So you were engaged when you were going through this, and then you started your private practice because you wanted to be at home as a young mom and be flexible to spend quality time with your sons, right?
Yeah.
So
yeah.
Tell me about that "it has to be me" moment where you just went, okay, I got to change some things here, and I want to, it's good, but I need it to be great for my changing situation as a young mom.
Right. Yeah. I really wanted to, I really wanted to get to a place where I could still work. But still, I always say, like, when I'm thinking about working with a new client, I always say I take my kids to school every day and I pick them up. And I can't compromise outside of that. I mean, every once in a while, yes, I'll compromise outside of that. But for the most part, that's really important to me. I want to get everything done while they're in school so I can be present and with them when they're not in school. So I think sometimes the only way to do that is to kind of go out on a limb and build your own business, because then you're your own boss. I mean, if you're working for someone else, they'll control your schedule. They'll tell you when you're coming, when you're going. So that was really important. And I think, there's so much, but there's so much risk and fear into going off on your own and building something, right? It's just so much.
It's so exhilarating. If you are not the lead dog, the view never changes. And being able to do it the way that you want to do it, there's such joy and value and peace in that, for me anyway. Tell me about how that changed things for you, opening up that practice and consulting with people in a different way than you had been at Cleveland Clinic. You're interpreting data, right? That's one thing I loved about what you had said to me when we first spoke ages ago. You went, I'm simply interpreting data, right? So, you're used to interpreting science data. And then obviously as a human being, as a woman, we're interpreting all of that anecdotal, physical data. When you say it's scary and you were starting something, for people listening going, oh, I'm thinking of going out on a limb and taking a big risk and leaving my high-paying, secure job to go start my own thing. What were some of those data points that we can't put on a spreadsheet for you? You talked about it earlier where you knew this wasn't my calling. I'm not going to work in politics. This doesn't feel quite me. And you were telling you're telling your sons about this. You got to go through many iterations. When you decided, it has to be me right now, I got to make some changes, I'm going to start this business, what were some of the things that you said to yourself, just so we can steal some of these things from you?
I think what you said, Tess, really resonated with me, that the view doesn't change when you're just in a large organization, and it could still be very fulfilling. But when the view doesn't change, you can't necessarily grow. So what really helped for me, so what I think, like, the data was really the challenges, the things I tried to put off, right? So even as a writer, getting these assignments from my editor and then looking at it and being like, oh God, okay, I gotta write this. I'll do it tomorrow, or I'm gonna do it over the weekend, right? Like putting it off and then finally getting into it. But when you are constantly putting together articles, or you're constantly looking for different clients from different areas of the food industry, you grow so tremendously because you have to, right? If I'm going to write an article, I wrote an article, this was a few months ago for the Today Show. My editor asked me if I would write an article about the carnivore diet. And someone had said to me, like, I can't believe you took that assignment. Like, that's got to be the most unhealthy diet ever, right? And I was like, yeah, but that doesn't matter. What mattered is that I took multiple days and combed through all the data. And now when someone says to me, what's your opinion on the carnivore diet? I can give them an evidence-based answer, not just the opinion of, oh, well, there's a lot of meat, so it's probably not good for you, right? So it forces you to constantly be up on research. And I can't tell you how many clinical dietitians, again, it's not to devalue them by any means, but I have many colleagues of mine that are clinical in the hospital. I could never do what they do. They're so good at it that they're on autopilot. Like, you could get the most complex case, that case comes in, they know exactly what to do. Whereas I'd be like, oh, I'm going to kill this patient if I get, all right, like I need to step back and study. I need to go back to the RD exam. So they're really good, but they're on autopilot for just that one area of where their practice is. So I think when you take on different clients, when you take on different assignments, when you say, I'll do this, when you put your hand up and say, okay, I'll take it on, and you know it's going to be hard work and you're not comfortable with it, that is when you grow. Because
yes,
then, go back and you can have a conversation where you could say, there was this study that came out a few months ago, and I would only know about that because I just wrote about it. So I think I like getting into areas in my career that I don't have that comfort level. Because if I have that comfort level, I'll be on autopilot. And that's great. I'll coast. And I know I'll do a great job because I know it so well. But it's the stuff that makes you uncomfortable where you're forced to learn about something that you didn't know before.
Oh, yeah. I love that. I love that. So that's one of your yardsticks, is pushing yourself, wanting to grow, wanting to try new things, seeing what you're made of, seeing what, because, we're so many things that we didn't even dream that we are, or that we're possible of being, right? Until we stretch ourselves. So let's talk about this writing piece, because you're such a prolific writer and have written so many articles. They're out there in so many different places. It's really impressive. But then you write your book, right? Your first book, Skinny Liver. And then the follow-up, Regenerative Health. Tell me how that came about. Why the liver? Out of all the things that you've written about and all the things that you're interested in, and the important things that we need to talk about in health and nutrition, why the sexy liver? I love the
so sexy. I know.
Oh, it's so sexy. Why the liver is so sexy. One of the things I love about your book is how you make it sexy. You make it so and digestible. Some of those medical books, they're quite dry and boring. And it's like, okay, I learned a ton, but oh gosh, let me go, whatever. You've got all these funny analogies and liken the liver to a superhero. It's just such an interesting, entertaining read, whilst at the same time very educational. Why is the liver so sexy?
Yeah. So it's interesting. Let me just say, I'm also the first person to tell you I don't know something, right? Like, there's part of being successful.
I love about you.
Yeah, I mean, part of being successful is the humbleness of it, right? And that's a big thing I try and teach the students that are with me. The second you lose your humbleness and your arrogance about your skills, that's it. And people will see right through it. But I think for the liver, when I decided to kind of get into this, become an expert in this area, I too knew nothing about it. I really didn't. My office was being flooded by people that would say, I saw my doctor. He says I have something called fatty liver. There's no medication for it. And so here I am. And I was lost too. So it was so new in our world. And what I noticed was there was no manual. There was no medication. Now, there was this huge announcement about 4 days ago that the very first medication ever to treat MASH, which is the latter stages of non-alcoholic fatty liver disease, has been developed. But back then, even just 2 weeks ago, we didn't have that. So it was a real opportunity to learn about this, to help these patients. And as I just kept looking at this more and more, I realized we need more information about it. And I do use the word sexy because I remember when I was writing my first book, Skinny Liver, and people were like, oh, you should write a book, you should write a book, you should write a book, right? So for them, when people said, oh, you're writing a book, what is it about? And I'd be like, it's about the liver. Like I'd look down, I'd be a little bit embarrassed, like it's about, and so it was just kind of like, I had this kind of shame that I wasn't writing this really dynamic weight loss book. But it ended up helping a lot of people. So, you have to keep that in mind as well. And right. And that's what I love about, the concept of your podcast. It had to be me. There was no one doing anything about the liver, nobody. And I just thought, okay, well, it's not the most exciting organ. We don't talk about it that much, but you know what? I'm going to attach my name to it because no one else is doing it. And I really want to help people. And then as we learn more, we realize that it's so closely tied to metabolic health, to insulin resistance, to, I was just putting a presentation today about menopause. So looking at the risk of fatty liver after you get into menopause. So it's just so pervasive and it's so ignored that I just felt like, gosh, there's so much we can learn as a community about really respecting this organ and reversing some of the damage that we do to it.
Yeah, I mean, I just love the name of your follow-up book, Regenerative Health, because the liver can regenerate. It's so incredible, right?
The only organ. Yes,
so
yes.
What were some of the things that really surprised you when you really started to delve into this about the liver that we really need to know about, and specifically about non-alcoholic fatty liver disease? We think that it's about fat, and then we thought it was sugar, and then you realized now it's about metabolic health. Can you just talk through that? Because we all need to know about this. It is just so incredibly fundamental to our health. What do you want everyone to know about this?
I think, or we think it's about booze, right? We think, oh, okay, well, if I don't drink, nothing's going to happen. I'll be fine because, I don't drink alcohol, right? So there's all these misconceptions. And I do think there's some shame associated with it. I didn't realize that until I started working with Dr. Hanane, who's a hepatologist. And he said that when people would come into his office and he would say, hey, we ran these tests. You have non-alcoholic fatty liver disease. They'd be like, I don't drink that much. What are you talking about? Right? Like they would be very defensive on the, oh, but I don't drink. So there was also shame, the stigma of any alcohol disease. We initially go to, you're an alcoholic, right? So I think that's kind of important piece number one. What we know is that the liver plays a gigantic role, a huge role in blood sugar management, in terms of storing blood sugar, in terms of releasing it when it senses that the body needs it. And then it can be also very involved in mismanagement. So when you have someone like my 16-year-old self that has insulin resistance, what happens is that the liver becomes very overwhelmed with the ability to manage blood sugar. And when it doesn't understand what to do with the blood sugar, that blood sugar essentially turns into fat within the liver. And then it kind of creates this cascade of inflammation. So we do know that insulin resistance, really any component of metabolic syndrome, can lead to non-alcoholic fatty liver disease. So when we think about what do people need to know, what should people know, it's not about weight. It's about where are you carrying your weight. So the weight that you do have, where are you carrying it? And then number two, do you have any component of metabolic syndrome? So those are like the big things we really wanted to tackle, that, we have to take away the stigma that if you're fat, then you're unhealthy. And that's just not the case. We have plenty of people whose metabolic numbers look really good, but they're struggling with weight and they need to lose weight. But it has nothing to do with their health. Maybe they want to lose weight for other reasons. So I just think the most important thing to recognize is that this is impacting so many people, and the liver is so amazing and so resilient that it's going to take such a punch before it gives you any sign that you got it. And sometimes, you'll be in the latter stages once that happens. So it's this call to action to not forget about really, the most important organs in the body that are keeping you alive. And that's essentially what this organ is doing.
And that's why it's sexy.
So sexy.
So sexy. And it regenerates like a superhero. It's incredible. One of the things that I found so interesting about regenerative health was just really helping people understand what metabolism is and what metabolic health is and the bio-individual component of that story. So can you just talk us through the different kinds of the different metabolic types? Because and if you do not have a copy of Regenerative Health, I'm telling you, it is such a great read. I read it in one day, because I was laughing and it was so entertaining, but just because it was a page turner from the sense of, I need to know this. Oh, okay, now we know this about liver disease. I mean, it's just the knowledge that you put out there in this book. It was such a huge learning curve for me. So thank you so much. And I know for so many people in our community.
Thank you for reading it. Yeah.
Yeah, it's incredible. So what are the metabolic types?
So we created metabolic types to really kind of put people in areas to think about, okay, what is my risk? And based on my risk, what are some of the interventions I should think about? So we really broke it down into 4 different types. So if you were someone who has a normal waist circumference, but your metabolic numbers are a little bit off, then that's type number 1. The next type would be that your metabolic numbers are perfectly fine, but your waist circumference is a little too high, right? Then you have your waist circumference is fine, your metabolic numbers are fine. So for the people in that camp, if you're like, okay, well, I don't have any risk, that's more going to be associated with if you have the genetics that are associated. So we found a lot of data showing that if your mom had non-alcoholic fatty liver disease, or even insulin resistance or gestational diabetes while she carried you, you're much more prone to develop it yourself, even if those numbers aren't there. And then, of course, we have people high waist circumference. So for a female, it's going to be over 35, a male over 40, and then some metabolic numbers off. Your hemoglobin A1C, your triglycerides, your blood pressure. That's really kind of how we broke it down. So there's kind of one intervention that we would suggest for someone who just has the genetic risk factors, but doesn't have anything to make them from a pathophysiology more likely to develop this, all the way to someone who waist circumference high, your metabolic numbers are not good. There's different kind of planning, but I was so hesitant on putting any plan in the book because I didn't want people to think this is about deprivation. I now need to be on a diet. So that's always the challenge, right? How do you communicate? These are some dietary interventions, not diets, but dietary interventions that have been tested in research to reverse non-alcoholic fatty liver disease versus here's the diet you should go on. So what we tried to communicate is you can kind of go in and out of any of these plans. The goal was just to open your eyes to it and give you enough recipes, snacks, things like that to get you on your own to be able to go forward with reversing the condition.
Yeah, and just to empower people with the knowledge and resources.
Right.
And that is what these 2 books do, right? So to me, they're like little salt and pepper shakers in terms of your little manual for how you can love on your liver. What are some of the main things that we should be doing to love on our liver, to make sure that not only we reverse non-alcoholic fatty liver disease if we indeed get the diagnosis, but we go into proactive prevention status where we are not going to develop it?
So I would say, like, number one, of course, we're going to think about food because I'm a dietitian, but I would say sleep is really important. And a lot of times we kind of minimize the importance that sleep has. So if we're not sleeping well, we're not going to be able to eat well. So that's kind of, I always mention sleep first because sleep really makes a huge perspective here, getting consistent sleep. Which again, I didn't really recognize this until I started researching this. I would have a normal bedtime and wake up. And then on the weekend, I would sleep in. And so now we know from the data that if your sleep is more consistent, you're not sleeping in on the weekend. You're still setting that alarm for 6 a.m. That is more prone to better eating habits. It's more prone to better health. So, really keeping that consistency. So I think that's really important. I think from a dietary perspective, just having more color. Like, just get more color in your diet. You get more color in your diet, you're getting more fiber in your diet. So I think that's really important. Depending on where you are with the condition, if you're a little latter within the stages, drinking less does help. I mean, I can't tell you, at least half my patients started having a glass or 2 or 3 of wine every night during the pandemic. And then all of a sudden they're up 30 pounds. And it was the alcohol. It was for sure the alcohol. So really kind of looking at alcohol, just taking a deeper look into it and saying, okay, where is my alcohol status? And can I bring that down a little bit? That will always help as well. I love this concept of natural movements, which we see in the blue zones, right? I always say, like, people in the blue zones, they don't go to a gym, they don't have a personal trainer. All those things are fine, but they have natural movements. They go from one place to another and they're walking. So I think, like, I try and stick with more high level, get more color, make sure you're getting consistent sleep, natural movements. Those are really important perspectives. It's not always easy. I have plenty of patients that will just be addicted to ultra processed foods. And it's no different from me being told just have less of them, because they have those addictive properties. So sometimes we have to go a little deeper and start really on a baby steps approach and not just say, oh, okay, I'm going to have 8 colors and I'm going to sleep better. So really kind of, if you had to give it a hierarchy, what could you do this month? Is it just, I can have 2 vegetables this month and that's all I can do. But taking the time to figure out what can I do right now, as opposed to what are the 20 things I can do for better wellness right now? You're never going to sustain that.
What was the thing that surprised you the most when you were working on this book, doing the research, looking at the data, interpreting it, continuing to see patients, asking your patients, working in the real world? What was the thing that surprised you the most about this?
I think the thing that surprised me the most was, number one, how many people have it. And not that alone was surprising, but what was surprising alongside it was the asymptomatic nature of it. So all these people have it. It's like 1 in 4. So if you go and you walk out to the grocery store, 1 out of every 4 people you pass has it, probably don't know it. And because there's no symptoms.
That's a alarming statistic.
Well, and the latest data test really does, they really think those numbers are low. So we think it's probably closer to 30% globally of individuals that have it. It's very much in line with type 2 diabetes and insulin resistance. So again, diagnosed versus undiagnosed.
Status.
Oh, absolutely. It is an epidemic. It is an epidemic. And it is it's also the number one reason why someone is more likely to get a liver transplant. It's not cancer. It's not liver cancer. It's like, so this is like kind of gained the status of, if we look at the rationale from a medical perspective of transplantation, most of the reasons why people have a liver transplant is because they have gone from the early stages into cirrhosis and the liver is no longer working. And it's so ironic because I have so many patients that will say, they'll shoot me an email and they'll be like, hey, what do you think about this cleanse? Like, what do you think? Right. And I'm always tell them, like, just take the money you'd spend on this cleanse and just go buy yourself some better food. All right. So we just, again, like,
Yes.
we have to embrace research. And so that was like the surprising thing, that so many people have it, but they don't know it. And when you think about blood pressure, so many people assign it to it being the silent killer. We know that phrase. We've heard it. We've seen it written. Blood pressure is a silent killer. You don't have a symptom, but it puts you at risk for stroke and heart attack, etc. We don't have a similar phrase for the liver, but it truly, the condition is a silent killer, because it goes to a level at some point, if you don't reverse it, where the liver is no longer functioning. And the only solution is transplantation. That's way down the line, but it's still a possibility. We see it all the time.
Yeah. You talked earlier about how the liver is so magical and incredible and so resilient, was the word that you used, which I love, that it can take years for chronic symptoms to develop, which we don't want to get to that place, right? So if we've got all these people, all of, so many people, 1 in 4 you're at the grocery store, one of you's got it. How do we know that we have it, and how do we get diagnosed? How do we get tested? What does everybody need to do to what's going on with their liver?
Right. Well, as cliche as it sounds, number one is just seeing your physician every year, because most physicians will run just a normal liver function test. It's usually part of your regular blood work. So that's kind of number one. If your liver enzymes are off by any means, then they might look at other things, or they might look at other things and then decide to run your liver enzymes. So they might say, oh, you know what, your blood sugar is a little high, and I notice your waist circumference is a little high. We're going to run a liver panel test just to see what's going on. So typically you're diagnosed from that perspective. Some physicians will take an ultrasound to actually look at how much fat is in the liver, to see the staging perspective of it. And then very rarely you'll see a biopsy be part of that diagnostic approach, but usually ultrasound and then just liver enzymes. So when do you start seeing symptoms? You might not see symptoms until you start getting more scarring. So that's one thing I say, like, when you cut your finger, all the white blood cells go rushing there, it swells, and over time it heals. What happens in the liver is you're essentially cutting your finger within the liver. The liver's trying to heal itself. It's not being successful. And so it just continues to draw this scar tissue, and it's just not healing. So it's scar tissue, scar tissue, scar tissue. And then that scar tissue and the fat replace healthy liver cells. So once you start getting to that, what we refer to as fibrosis, or we get into NASH, once we start getting into those stages, then you could start having more fatigue. Once you start really going in, you could have itchy skin. You might even have a little bit of, like, your brain's not working correctly because the liver can't break down ammonia from protein. So if it can't convert and break down, then that's going to the brain. And people are like, what's going on? This person is out of nowhere. What is it? Right. And it could be that the liver function is just not really working at that point. So, there's a lot of the early symptoms are very non-specific. I mean, I don't know one woman that is not fatigued the majority of the time. So,
right, is that there's so many symptoms that could indicate that there's a problem with your metabolic health. There's issues with your liver, that you might have non-alcoholic fatty liver disease. What are some of the most common symptoms that we just take as, oh, gee, it's just life. I'm just stressed. I'm just tired. Oh, I've just been busy this week, that we continue to ignore, but that would indicate that we want to go to our doctor and have a conversation and say, hey, listen, I need to get all my blood work done, and we need to go for that annual checkup. What are some of the most common early symptoms that we don't want to be ignoring?
Yeah, if I look at my patient base, which is, the majority, I'd say 85% is female, brain fog is a big one, right? So they'll just have brain fog, right? So what are some of the reasons why? And we'll kind of break down all of those, but it could be fatty liver, especially if it's in conjunction with other things going on, right? So brain fog, the fatigue, even something as simple as really challenging with sleeping, which you wouldn't think about that, right? I mean, again, it can mimic so many other things. My patients that are peri and postmenopausal, they struggle with sleep. So is it that we're going through that, or is it because we're having some challenges with the liver? I think all of those things can be really the early symptoms, but they could also be assigned to so many other things. So that's why it's like, this is really a condition where the blood work is very telling. It's very telling. And it's interesting. Like, I feel like since I wrote both of these books, and I'm not a hepatologist, right? I'm not anywhere near where Dr. Hanane is, but I've had people that have gone to their doctor, their liver enzymes are slightly elevated, and then they'll email me and say like, oh my gosh, my liver enzymes are elevated. Like, and they never looked at it before. So just kind of like this awareness before even one symptom may occur. And it might have, it might have to do with the fact that their liver's not clearing a medication. That could increase liver enzymes. Certain statins could increase liver enzymes. So sometimes it has nothing to do with fat in the liver, but our attention to it, I feel our goal is to increase it. Just start thinking about it a little bit more.
Oh, well, you have achieved that goal in spectacular fashion, my friend. And I love that you teamed up with Dr. Hanane, because just the clinical data, the research, the knowledge, the breadth of experience between the two of you, it's such an incredible collaboration. So Skinny Liver, Regenerative Health, you can get them wherever you get your books, online or at bookstores. Such great reads. Thank you so much for these.
Thank you. Yeah.
What's your next It Has to Be Me? Or what's something that's bubbling up in you right now? Like from writing these books, all the incredible work that you're doing. I just want to know what's next. Like, what do you feel's kind of churning around in there that's calling to you at the moment?
I think, we tend to, especially if as we go through life, we tend to embrace more the things that are impacting people around us and ourselves. So I'm really just so interested in engaging with women that are going through perimenopause and menopause. That's kind of been something that I've been really interested in, because it is such a challenge. It is biologically inevitable, right? Completely. So it's not like, oh, you might get it, and then, no, you're going to get it. You're going to get it. Right. So I think like as women, we just really need to kind of come together and have a conversation a little bit more about this, and even some of the opportunities that are surrounding this. And I fully admit that this was, it's because I'm going through it myself. It's interesting. I asked my editor at the Today Show, I said, can I write an article and can I put some personal perspective on menopause? And she said, oh, I love this, right? And so I started the article by talking about last year I was presenting at today's dietitian conference. And I said, right before I hit the stage, my pants, which were barely hanging on, the button popped. And I was making a joke about how if it flew in the right direction, you would have gotten a bruise. It was going at such a high velocity. So I started talking about it all started with this button popping incident. And then I went into all the science, and here's some things to talk about in the belly fat, and that's really what it was. But what I got emails about was women that were like, you know what? My button popped. And it was at a dinner. And then all these women were telling me their button popping stories, right? So it's just kind of like, and I just want to feel like when I was younger and I wanted to embrace and help people that needed to lose weight, it was because I was going through it. And now that I am, getting to my 50s, I'm going through this. I want to go back to that. I want to go back to being vulnerable, and just telling people I am not perfect. My diet is by no means perfect. I have the demons from my childhood. Believe me, I will never have a nutty bar in my house because I'll eat the box. I won't control myself. So it's just like, I want to take that from a menopause perspective and say, we're all going to have this button popping experience. So how do we embrace the body that we are now getting and focus on our health and focus on reducing the risks that come along with a loss of some of these hormones? So I don't know
Yeah.
where I feel, I'd like to
Oh, I'd sign up to read that book. I'll sign up to listen to that. I mean, but I really love how you recognize, taking it full circle from our conversation in the very beginning about not being seen. Not
Yeah.
being seen when you were that young girl, using food to comfort, placate, hide, where so many of us are doing that. I think we're a mixture of all of that, right?
Yep.
And
Yep.
you bringing that into your work and being able to see yourself and who you are today and what you're struggling with, and using that, and also being able to see your patients, see people that you're interacting with on your book tour and stuff like that. What would you say to somebody that doesn't feel seen right now by their practitioner or
Mm-hmm.
by their friendship circle? You've really been able to navigate that space in a really beautiful way and hold space for others. What would you say to somebody right now?
I would say that, number one, you have to really kind of develop, not so much the word confidence isn't the right word, but you have to develop kind of this appreciation for your body, the changing of your body, and then look at how it impacts your why as you move through life. Our whys change throughout life. When we're young, our why is, I want to look great in my wedding dress. And when you get into your 40s and 50s, it's like, okay, my why is I don't want to get dementia like my mother got, or I don't want to get cancer, right? So our whys change. So I always encourage people, like, look at their why. And it's interesting, just talking about if you're not seen by your doctor. I can't tell you how many of my patients have emailed me and said, I really want to get on a GLP-1 agonist. I want to get on Ozempic. I asked my doctor's not going to put me on it, and he made me feel shameful for it. So it's just kind of like, okay, so how do we take that information and really kind of break down, is this something you want to do? And how do we speak with the right health practitioner to figure out if that's what you want to do? We give so much importance. If we have a great doctor, it's great. But sometimes we give so much importance to one person who we've worked with. There's a whole world of health practitioners that might be better, right? Not to say leave our doctors, but really connecting with someone who just speaks your language and can sit down and have a conversation with you, as opposed to just saying, this drug's not right for you. Right. So I think, like, we are evolving as a society, especially because some of these drugs. And I think that we need to look at, how does all the things that the medical world has provided to us, how does it relate to us, our why, and our path of longevity, right? What does that look like for us? But it starts with kind of looking at your own worth before having to accept worth that others give you.
Yeah. One of the conversations you and I had a while back, and I've never forgotten it, you were talking about when you chase the money, it never ends well for you. I'd love you to share that with everybody, because we define success. Everyone's got their own definition of success, but often it's tied to how much money you make, or your status, or recognition, or whatever. And I love that you're always tying it back to the why, right?
Yeah.
What does it feel like for me? The impact I want to make. What do I want to do with my life? The version of me, going back to what you're teaching your children now. So, let's close with that, because it's such a beautiful thing. If somebody's out there right now struggling to know which version of themselves they want to put out today, or that they want to be today, or struggling to find that, or just start that thing they're dreaming about, what's the big thing that you ask yourself?
So I think, I think what people should ask themselves, what they should look at is, number one, there could be multiple versions of yourself that you have, even in one moment, right? You don't just have to be a mom. You don't just have to be a great dietitian. You can be a great dietitian one week and a subpar mom, and then the next week you're a great mom and a mediocre dietitian. So I think we're going to constantly evolve. There's never going to be this constant of what is perfect today and tomorrow and the next day. So I think that's really important. We oftentimes don't do it. just our previous conversation about like chasing the money or chasing the recognition, really kind of stopping and asking yourself, what creates happiness in me? And oftentimes it's not an award, it's not money. And we know from studies that doesn't create happiness. So what creates fulfillment? What creates happiness? Really kind of having the courage to look at that. Sometimes having more time creates happiness versus working your butt off for money and feeling miserable every moment, right? So I just think like we often hear this cliche that we need to give our kids experiences and not things. And for a lot of reasons that is true, but we also need to do that for ourselves as well. And I think we fall into like, we give that advice to kids. We're going to give you experiences, not things, and you're going to grow because of it. But then we don't do it ourselves. So really kind of taking that step back and saying, okay, what is the experience I want my life to have? Because that ultimately is what leads to better wellness. Chasing a number on the scale, chasing a certain salary. I haven't had a patient yet that says they reached it and they found, nirvana. There was something missing. So we have to figure out what that piece is before we can chase anything else.
I feel like a sunflower. It's like, thank you. Hello, sun. It's great. Thank you so much, Kristen, for joining me. Oh, what a beautiful conversation.
Thank you. I love it.
Kristen at Kristin Kirkpatrick. And you can get a copy of Skinny Liver and Regenerative Health. Please, such great reads. I will put everything about Kristen on our website at ithastobeme.com and also in the show notes. Kristen, I just cannot wait to see what you're going to do next.
You too, Tess. I love you. I adore you. So thank you. It's such an honor and privilege. Thank you so much.
Always an honor and privilege, my friend. Love you. I will talk to you soon.
Wow, what an eye-opening conversation. The relationship between blood sugar and fatty liver disease and the importance of understanding your metabolic type. And those statistics of over 1 in 4 people, actually up to 30% of the global population having fatty liver disease and many people not knowing it, that was alarming. So please go and get your annual blood work done and your checkup with your doctor and arm yourself with the knowledge to know if you have fatty liver disease and know that there's hope, that you can reverse it with some simple food and lifestyle strategies so that you don't get to the end stages of liver disease. So definitely get a copy of Kristen's book, Skinny Liver and Regenerative Health, because they really help you to understand this topic and give you some really tangible strategies to love on your liver. Some of my other key takeaways from this conversation were at the beginning, where she was talking about giving yourself permission to try different things in order to get clear about what your calling is, what you want your contribution to be. And also knowing your worth instead of just accepting the worth that others give you. And finding a practitioner that gets to know you, that understands you in order to help you chart your unique path to longevity. And also anchoring yourself to your why. What do you want your experience to be in your life, instead of just blindly chasing the numbers on the scale or the numbers in your blood work? Listening to your It Has to Be Me. What do you want your life to look like? So I want to know what your key takeaways are. So join our community and leave a review on Apple Podcasts. I'll be looking forward to reading your comments. I want to hear about your It Has to Be Me story. So head on over to ithastobeme.com/stories to share it in our free community. You can also join the conversations we're having about this episode and others. I'm Tess Masters. Join me next week and we'll dive inside another great story to help us go from dreaming to doing.